Hello and welcome to the AMPed podcast. I'm Jared, and joining me today is my co-host Noam. This episode is intended for people who are curious to learn more about trauma, as this is a series about trauma and mental health that we're excited to conduct over the next few months with various trauma experts. You can find all relevant resources linked below the interview, including references, and we hope you enjoy the discussion.
Before we dive into specifics regarding the impact of trauma on nutrition, can you first share a bit about what trauma means?
Yeah, so a traumatic event per the DSM-5 is exposure to death, actual or threatened serious injury, or actual or threatened sexual violence. So in a physical sense, it's the body's response to a stressful event or experience that overwhelms its ability to cope. But from a mental standpoint, which this definition largely fails to capture, trauma encompasses the emotional and psychological response to an event of that nature. And this psychological distress can, to no surprise, influence patient health, well-being, and overall quality of life. And also throughout this discussion, I'm going to mention PTSD. So what is PTSD? It is a disorder triggered by a personally experienced or witnessed traumatic event. And when I say triggered, I'm referring to some of the typical features of PTSD, like avoidance, dissociative reactions like flashbacks, persistent negative emotions like fear, horror, guilt. The list goes on. I couldn't find it anywhere, but I think it was another podcast I was listening to. If anyone knows where it's from, please let us know. It's basically that trauma is like a storm that shakes the core of who we are, and PTSD is like the aftermath, where like the thunder and the lightning, the sounds and the boom still linger in our minds. So I think that's a great analogy. I think it helps paint a picture of what we're talking about.
Yeah. So how does trauma impact an individual's relationship with food and overall nutrition? If you can, try to touch a bit on the associated physiology if possible.
Yeah, so it's well established that obese patients report stress as a primary trigger for binge eating. But not just that, stress can also be a precipitating factor in the onset of anorexia and bulimia. Now think of trauma as experiencing like the most extreme version of stress. So the effects of these types of events on nutrition are heightened dramatically and are longer lasting. There was actually a study conducted in 2017. Like I said, links to these, the references will be below. And this study showed that PTSD symptoms were found to be associated with a 2 to 3-fold increase in binge eating and coping motivated eating. They also found that the more PTSD symptoms one exhibited, the more likely these individuals were to exhibit binge eating behaviors down the road. On a physiological level, in very basic terms, when the body experiences a traumatic event, the stress response is activated, which leads to the release of stress hormones like cortisol. And that's a molecule that stimulates appetite, especially for foods high in calories and fats, carbs, sugars. So that's like a superficial overview.
It's really interesting. And for listeners who may have experienced something like what you're talking about, being an increased urge to binge eat or less of a desire to consume food in general, what remedies are out there that can help?
Yeah, so there's been lots of evidence on cognitive behavioral therapy for PTSD, CBT, and eating disorders being beneficial. CBT largely focuses on identifying and challenging negative thought patterns and behaviors to promote healthier emotional responses. And given that poor emotional regulation has been cited as a leading cause for eating disorders in PTSD patients, working on such emotional responses can be like hugely beneficial. Of course, there's the medication route. Antidepressants, especially SSRIs, have been shown to help patients with PTSD, and they also help ease anxiety and depression that often go along with binge eating and anorexia and bulimia. But I encourage listeners to do their due diligence to learn more about CBT and medications like SSRIs and to consult their physicians. This is not medical advice, just an overview of what the literature has mentioned as potentially beneficial routes to take.
You've mentioned conditions like anorexia and bulimia. These are conditions that people tend to associate with younger people, like female teenagers, for instance. So for teenagers and young adults, how might trauma influence their developing relationship with food and body image?
So for teenagers, the impact of trauma on their relationship with food and body image is strongly tied to the unique changes that occur during adolescence. During this period, the brain is obviously undergoing significant development, and hormonal changes are heightened. And trauma during these formative years, whether it's physical or emotional, can disrupt the delicate balance of neurotransmitters and hormones, influencing not only mood, but also appetite regulation. This includes elevated impulsivity and, as mentioned before, poor emotional regulation. which can lead to worse food choice and less regulated food intake, especially in teenagers, as teenagers experience heightened emotional reactivity, making them more susceptible to emotional eating as a coping mechanism. And this is most notably true in populations of teenagers who experienced physical abuse as children. One study actually found a significant relationship between childhood trauma and eating disorder symptoms in adolescents, specifically from 13 to 18 years old. Children with multiple traumatic experiences, meaning death of a parent or a friend, traumatic sexual experiences, even extreme illness or injury at some point. And the severity of those experiences demonstrated a relationship to overall eating disorder symptoms and a negative relationship with nutrition.
So we touched on the adverse effects of trauma on the nutritional habits of others. What about the positive aspects of food on healing from traumatic events?
Yeah, I think that's a really important topic to discuss, especially in this forum. So consider the gut-brain axis. This describes the communication between the central and the enteric nervous system, basically the brain and the intestines. In the simplest and most digestible manner, pun not intended, think about it this way. If you feed your gut junk food and your gut connects with your brain becomes a victim to this junk, and vice versa with healthy, highly nutritious food. So after a traumatic event, especially in developing teens, if your body and mindset are both suffering, food can be a source of medicine, like an avenue for healing with long-lasting positive effects. Again, notably important for teens. Studies have shown that reducing the consumption of dietary excitotoxins, which is basically foods with chemical food additives, like found in processed foods, normalized cortisol levels, which has been associated with alleviating PTSD-related symptoms. In 2017, the SMILES trial explored the positive influence of a dietary intervention on depression. Another study highlighted the positive impact of diet on mental health as well, specifically in patients following a Mediterranean-style diet. Studies on the carnivore diet have even shown to be beneficial towards enhancing one's overall quality of life and sense of well-being. So while there's definitely harm that stress and trauma and PTSD can have on one's nutritional habits, there's also so much out there that can help those who are struggling. So yeah, food can truly be medicine. And that's all the time we have to discuss the impact of trauma on nutrition. Thank you all for tuning into this discussion on the impact of trauma on nutrition, and as I highlighted at the end, the impact of nutrition on trauma. Continue to stay tuned for Noam's discussion on the impact of trauma on family life, and for the rest of our series with trauma experts soon to come. Thanks again.